discuss more and more.
I will invite Jebinth BRAYAN. He is a cataract surgeon from Arvind, and he has a guest lecture. So, request you to go ahead.
Thank you, sir. Thank you for giving me this opportunity. Wishing all a pleasant morning. And as ophthalmologists, we should take the pride that we belong to the sector of medical fraternity that boasts one of the most commonly performed surgeries worldwide. The commonality may mask our days, but remember, each eye is unique, but so each patients are. So I'm here to tell certain special situations which defy the deployment of conventional cataract surgery. Be it a middle-aged security left crippled by life-changing accident, or an 8-year-old fragile wheelchair-bound nighty-called party afflicted with hemiplegia, or a 70-year-old gentleman severely skyforced but shouldering years of wisdom. The stories may be plenty, yet it all, we could see their gleaming eyes holding unflattering hopes of brighter tomorrow. Their physical condition or grave systemic comorbidities have served as an hindrance for them to receive quality eye care at several places before they presented to us. But their indomitable spirit of not giving up what may propelled us not to give them on us. So in search of literature revealed that options such as face-to-face emulsification using slit lamp and face-to-face phaco in a semi-reclined position and operating in a motorized wheelchair. But operating in a center which caters predominantly to the people from humble background, these sophisticated options were out of question, and we at Aravind have always believed in delivering quality eye care which is affordable to all. After much deliberation, the idea of PHACOSIT, a novel 90-degree sitting phaco emulsification, was conceived using only available resources, a simple plastic chair or a wheelchair and an adjustable microscope. We have published this technique, innovative technique, in the Indian Journal of Ophthalmology in the year 2021. The process involves this following step. A sterile surgical drape was plastered in one side of the OT wall. To maintain asepsis, our patient is made to sit comfortably on a wheelchair or a plastic chair with their hands, head and cushion comfortably with pillows. Vitals were monitored with sphygmomanometer in one arm and pulse oximeter in other arm. After thorough skin preparation, another drape is used to cover the face and trunk, and it taped to the edges of the drape which is in the wall. The lids were kept open with speculum, and a drain punch was fixed inferiorly. The operating microscope was set at an angle of 70 to 80 degrees from the vertical plane. The surgeon sat at a height adjustable chair facing the patient upright in erect position. Meniere's disease may pose seeming innocuous condition, but you wouldn't believe, I told one of our patients was taken on table 3 times at different hospitals. But each time the surgery has been cancelled due to distressing systemic manifestation. The patient finally presented to us with hand movements in one eye and 2/60 vision in other eye. I opted to proceed with PHACOSIT for her. The left eye surgery was planned first. An inferior temporal self-sealing 2.8 clear corneal incision was made at 4 o'clock, and 1 mm side port was made at 7 o'clock. The only requirement from the patient that he or she shouldn't tilt, turn or move the head forward. After staining the antracapsule with trypan blue, adequate size capsular excess is done under OVD cover. Actually in PHACOSIT, that the phaco parameters we don't have to change. We can use the same parameters which we use for the regular routine phaco emulsification. We have done it in supine position. After good hydrodissection, the nucleus is rotated, and high molecular weight OVD is used to protect the corneal endothelium. And I prefer to do a direct chop technique in this patient. A straight chopper, vertical chopping is done. Almost 6 to 8 pieces are done. The only downside is that the surgeon has to operate with an outstretched arm, so prolonged surgical duration could lead to fatigue. Hence, I wouldn't recommend this for the novice surgeon to attempt this. So carefully the quadrants are emulsified one by one, taking care not to damage the corneal endothelium and also the posterior capsule. After removing all the quadrants, I used a coaxial IA to aspirate the cortex, and then forming the antechamber with visco. A single piece foldable IOL was injected and placed inside the bag. A thorough wash was given, and the antechamber is formed. But the right eye added to another level of complexity. As you see here, is having high astigmatism. So after calculating for an inferior nasal clear corneal incision, we opted to proceed with toric IOL placement for this in the right eye. The surgical steps for the toric marking part, other than the toric marking part, was same as we see in the last surgery. You may observe that both of the eyes were in advanced stage of cataract. This is in majority of the case of these PHACOSIT patients, because as they either have delayed seeking care due to their physical inability or were turned down due to multiple places before they reach on to us. The one tip I would add here is, like, you can make the additional bend in the tip of the cannula, the hydrocannula, so in the shape of U, which will be very helpful, easy in hydrating the corneal wound at the end. A special study was conducted to analyze the operative outcomes of this PHACOSIT patient. So far, I have performed more than 60 eyes, but the results of the first 33 were analyzed. All through the course of surgery, the patients maintained stable vitals, and highlights that our patients were comfortable and stable throughout the procedure. The average surgical duration was 10.37 minutes, and the average CD was 12.22. The average surgical duration in the left eye was less compared to that of the right eye. Right eye have a high significant CD values because of the nasal bridge acts as a difficult factor in doing right eye surgery. The testimonial from our patients serves as a positive testament to the efficacy and the comfort of this technique to our patients. The radiant smile adoring the faces of our patients highlights difficult roads often leads to beautiful destination. Thank you.
Thank you very much, Jebinth. I think